Welcome to the AHIMA CDIP Prep and Study Guide. In this course, you will learn how clinical documentation improvement helps create clear, accurate, and complete medical records. Good documentation supports better patient care and also ensures healthcare facilities receive correct reimbursement. As a CDIP professional, your role is to review charts carefully and identify missing or unclear information that may affect documentation quality. One of the most important skills is creating physician queries. When details do not match, or information is missing, you must communicate clearly and professionally, without leading the physician toward a specific answer. Your goal is to reflect the patient's true condition through accurate records, including severity of illness and risk of mortality. Daily review of labs, nursing notes, medications, and diagnoses helps uncover documentation gaps. Always remember, every detail in the chart matters, because it tells the complete story of the patient's health. Stay updated with the latest coding and documentation guidelines, verify primary and secondary diagnoses carefully, and focus on accuracy at every step. Subscribe to the channel for more exam preparation content, and get the full course from the link in the description below. 1. What is the main purpose of a physician query in the clinical documentation improvement process? It is used to clarify conflicting, ambiguous, or incomplete information in the medical patient record. Queries help us ensure the chart reflects the true condition of the patient you see. 2. Which term describes a condition established after study to be chiefly responsible for hospital admission? This condition is officially known as the principal diagnosis in the medical coding professional world. The principal diagnosis is the main reason the patient was brought into the hospital setting. 3. What must you avoid doing when you are writing a formal query to a doctor? You must avoid leading the physician to a specific diagnosis, because that is completely wrong. Leading queries are non-compliant, so you must always provide open-ended questions or multiple clinical choices. 4. How does high-quality documentation impact the severity of illness score for a sick hospital patient? It accurately captures all patient conditions, which usually increases the severity of illness score properly. When doctors record every detail, the data proves just how sick the patient actually is. 5. What is the best definition of a secondary diagnosis in a patient hospital medical record? It is a condition that coexists at the time of admission or develops during stay. These extra conditions require medical care, monitoring, or extended hospital stay time for the patient. 6. Why do we closely review lab results when checking a patient medical chart for accuracy? Lab results often show signs of diseases that the doctor forgot to write down clearly. If abnormal labs are treated but not documented, you need to query for a diagnosis. 7. What happens if a medical record is missing a clear diagnosis for an administered medication? The documentation is considered incomplete, and the hospital might not get paid for the treatment. Every treatment must link to a specific medical condition to justify the care provided here. 8. Which document is considered the most important source of truth in the patient medical chart? The history and physical exam note is widely considered the most important source of truth. It gives a full summary of the patient status on the day they were initially admitted. 9. How often should a clinical documentation specialist review a chart during a patient hospital stay? You should review the chart concurrently, which means checking it while the patient is admitted. Reviewing the chart every day or two helps catch missing details before the patient leaves. 10. What is a common sign that you need to send a query about respiratory failure? The patient uses a mechanical ventilator, but the doctor only wrote shortness of breath down. Ventilator use indicates a very severe problem, which usually requires a more specific medical diagnosis. 11. Why is it bad to use copy and paste functionality when writing daily progress notes? It can duplicate old or incorrect information, which makes the medical record highly inaccurate quickly. Doctors must write fresh notes daily to show how the patient condition is currently changing. 12. When is it appropriate to query for a complication that occurred during a surgical procedure? You should query when the surgical report mentions unexpected bleeding, but no diagnosis is listed. The surgeon must explicitly state if the bleeding was a true complication of the surgery. 13. What does the acronym SOI stand for when we talk about patient medical record coding? It stands for severity of illness, which measures the extent of patient organ system derangement. This metric helps hospitals understand the exact clinical complexity of the patients they are treating. 14. How does good clinical documentation directly support the hospital quality reporting and public safety metrics? Accurate records prevent the hospital from looking worse than it actually is on public reports. If complications are documented properly, the public health data will reflect the true clinical reality. 15. What is the primary role of a CDIP professional within a large modern healthcare facility? You act as a translator between the clinical providers and the medical coding staff members. Your job is making sure the clinical language matches the strict coding rules and guidelines. 16. Why must a query always remain part of the permanent medical record at the hospital? It shows proof of the communication between you and the doctor regarding the patient chart. Auditors might review the record later, so they need to see how the diagnosis evolved. 17. Which part of the medical chart usually contains the discharge summary for a sick patient? It is found at the end of the stay, summarizing the entire hospital visit clearly. The discharge summary is incredibly helpful, because it ties all the medical diagnoses together nicely. 18. What type of query should you use if a doctor writes two completely different diagnoses? You should use a clarification query to ask the doctor which diagnosis is actually correct. Conflicting information must be resolved quickly, so the medical coder can assign the right code. 19. How does clinical documentation improvement directly impact the risk of mortality score for a patient? Better documentation captures severe conditions, which correctly raises the expected risk of death score accurately. Hospitals use this score to show they take care of very sick and complex patient cases. If you found this video helpful, please check the description below for the full course. Now let us talk about hospital payment systems, because this is a major part of your CDIP role. Hospitals use diagnosis-related groups, or DRGs, to decide how much they are paid for each patient stay. The payment depends on accurate documentation of all conditions, including the principal diagnosis and important secondary diagnoses. Serious secondary conditions, called CCs and MCCs, increase the level of care and affect reimbursement. Your job is to review charts carefully, identify missing conditions, and send clear physician queries so the final documentation reflects the patient's true condition. A common example is when lab results show low sodium, and treatment is started, but the physician never documents hyponatremia. You cannot code based on lab values alone. Instead, you must ask the physician to confirm the diagnosis. Good queries are clear, simple, and supported with clinical evidence. You also need to watch for hospital-acquired conditions and confirm present on admission status, because missing documentation can lead to payment penalties and inaccurate hospital records. Another key responsibility is clinical validation, making sure diagnoses are supported by real clinical evidence. If documentation does not match the patient's condition, you must query for clarification to protect the hospital from audit risks and inaccurate reporting. Keep practicing chart review and documentation skills daily, because confidence grows with experience. If you are enjoying this course, please subscribe, and get the full course from the link in the description below. Now let us continue with more practice questions. 20. What system do hospitals use to group patients for Medicare payments based on their diagnoses? Hospitals use diagnosis-related groups, also known as DRGs, to determine their final reimbursement payments. The DRG system groups similar medical cases together, so the hospital gets paid a fair amount. 21. What does the medical coding acronym CC stand for in the hospital reimbursement payment system? It stands for complication and comorbidity, which represents a secondary condition that requires extra care. Adding a CC to the patient medical record usually increases the DRG payment for the hospital. 22. How does a major complication and comorbidity affect the final DRG assignment for a patient? An MCC shows the patient is very sick, which pushes the DRG to the highest level. The hospital receives much more money, because caring for these sick patients costs a lot more. 23. What should you do if a lab report shows severe anemia but there is no diagnosis? You must send a clear query to the doctor, asking them to document the actual diagnosis. Medical coders cannot use lab results alone, because only the doctor can officially diagnose the patient. 24. Why is the present on admission indicator so important for Medicare billing and hospital reimbursement? It proves the patient already had the condition before they walked into the hospital building. Medicare refuses to pay for certain bad conditions if they happen during the actual hospital stay. 25. Which term describes an infection that a patient catches while they are staying in the hospital? This is called a hospital-acquired condition, and it hurts the quality scores of the hospital. Hospitals try very hard to prevent these infections because they cause poor outcomes and financial penalties. 26. What does clinical validation mean when you are reviewing a patient medical chart for accuracy? It means checking if the patient actually has the disease, based on their clinical test results. If the clinical indicators do not match the written diagnosis, you must query the attending physician. 27. Why would an insurance auditor take money back from a hospital after a chart review? They take money back if they find a diagnosis that lacks strong clinical proof in records. The hospital must always prove the diagnosis is real, using lab tests and daily physician notes. 28. What should you do if the doctor writes acute kidney injury but creatinine levels are normal? You must send a clinical validation query to ask the doctor if the diagnosis is correct. The doctor might have made a simple typo, or they might have used the wrong medical terminology. 29. How does documenting a secondary diagnosis help show the true severity of a patient illness? It paints a complete picture of their health, proving they have multiple complex medical problems. A patient with 5 active chronic diseases is much sicker than a patient with only 1. 30. What is the main difference between a CC and an MCC in medical coding rules? An MCC represents a much more severe condition, requiring significantly more hospital resources than a CC. Conditions like acute respiratory failure are MCCs, while a simple urinary tract infection is a CC. 31. Why is it dangerous to assume a diagnosis based on a medication the patient is taking? Because many common medications are used to treat several completely different types of medical conditions. You must query the doctor to confirm the exact reason they ordered that specific daily medication. 32. What is the best way to ask a doctor a question without being non-compliant? You should use an open-ended question, or provide multiple choices based on the clinical facts. This allows the doctor to use their own medical judgment, without you forcing a specific answer. 33. What happens to the hospital data if a doctor forgets to document a complication during surgery? The public quality data will look completely wrong, and the hospital will lose well-deserved money. Accurate surgical documentation is required to show exactly what happened inside the hospital operating room. 34. Why do clinical documentation specialists need to understand the basic pathophysiology of common human diseases? Understanding diseases helps you recognize when a doctor forgets to write down a very important diagnosis. If you know the signs of sepsis, you can easily spot it in the medical chart. 35. What is the main goal of the Medicare Severity Diagnosis-related groups payment system currently? The goal is to pay hospitals fairly, based on the actual sickness level of the patients. Hospitals that treat the sickest patients deserve to get paid more money for their hard work. 36. How can a strong clinical documentation improvement program help protect a hospital during compliance audits? It ensures the medical records are highly accurate, which makes it very hard for auditors to argue. Good documentation serves as a solid legal defense, proving the hospital followed all the billing rules. 37. What role do nursing notes play in the daily clinical documentation improvement review process? Nursing notes provide valuable clues about patient symptoms, which can lead to a good physician query. Nurses spend the most time with patients, so their detailed notes are incredibly helpful for you. 38. Why is clear communication between the coding team and the clinical documentation staff so important? They must work together as a team to ensure the final medical codes match the chart. Strong teamwork prevents expensive billing errors and keeps the hospital running very smoothly every single day. If you are enjoying this learning journey, please get the full course in the description below. Section 3, as we continue preparing for your exam. Today we covered some of the most common conditions you will see every day, including sepsis, severe malnutrition, encephalopathy, and acute respiratory failure. Remember, accurate documentation is critical, because missing details can affect patient care, coding accuracy, and hospital outcomes. Always look for supporting signs, review notes carefully, and send clear queries when the documentation does not match the clinical picture. We also explored how collaboration improves clinical documentation. Dietitians, nurses, and providers all contribute important information, but final diagnosis documentation must come from the medical provider. Catching conditions early and ensuring proper clinical validation helps reflect the true severity of illness and supports better treatment decisions for patients. Finally, we reviewed important CDI performance metrics like query response rate, query agree rate, and case mix index. These measurements help hospitals track quality, improve documentation, and understand patient complexity. Keep practicing, keep building your chart review skills, and you will be better prepared for exam success. If you enjoyed this lesson, please subscribe and get the full course from the link in the description below. 39. What is a common clinical sign that a patient might have severe sepsis in the hospital? A very high heart rate and high fever are common clinical signs of a sepsis infection. You should review the vital signs chart carefully to find these important clues for a daily query. 40. Why do insurance auditors frequently target sepsis diagnoses during their regular hospital medical chart reviews? Sepsis pays a lot of extra money, so auditors want to make sure the diagnosis is real. Clinical validation is required to prove the patient was actually sick enough to have true sepsis. 41. Who is the only person legally allowed to officially diagnose a patient with severe malnutrition? Only the medical provider or attending physician can officially diagnose malnutrition for the medical coding team. Even if the dietitian writes a detailed note, the doctor must confirm and document the condition. 42. What should you do if the dietitian documents severe malnutrition but the doctor does not? You must send a clear and polite query, asking the doctor to review the dietitian note. This helps connect the clinical care team together, ensuring the medical record is completely accurate. 43. Can a medical coder use the patient body mass index number to assign a diagnosis code? The coder can code the body mass index, but the doctor must diagnose the underlying obesity. The numbers alone are not enough, because a medical provider must interpret what the clinical numbers mean. 44. What medical term describes a general brain dysfunction that often causes extreme confusion in sick patients? The term is known as encephalopathy, which shows the brain is struggling to function normally. This is a major complication for many patients, which increases the hospital severity of illness score. 45. What is the most common cause of toxic encephalopathy in a hospitalized older adult patient? It is frequently caused by a bad reaction to strong medications, or a severe untreated infection. Documenting this specific type of confusion accurately shows how complex the patient case has currently become. 46. How do we define the query response rate in a clinical documentation improvement tracking system? It is the percentage of your medical queries that the doctors actually answer in the chart. A high response rate shows that the doctors respect your hard work and read your important messages. 47. What does it mean if your query agree rate is very low for a specific month? It might mean you are sending bad queries that do not follow the actual clinical facts. You should review your denied queries with a clinical manager so you can learn from your mistakes. 48. What does the case mix index measure for a large hospital over a given time period? It measures the average clinical severity and resource use for all the patients in the hospital. A higher case mix index usually means the hospital is taking care of much sicker patients. 49. How does a successful clinical documentation improvement program directly impact the hospital case mix index? By capturing all the missing severe conditions, the program naturally raises the case mix index accurately. This proves the hospital is doing complex work, which helps them secure better future financial budgets. 50. What is the best way to get busy doctors to answer your chart queries more quickly? You should make your queries very short and provide clear clinical facts to save them time. Doctors appreciate when you are direct and helpful, which builds a strong and respectful working relationship. 51. Who should you contact if a doctor refuses to answer your clinical queries for several days? You should escalate the issue to the physician advisor, who can talk to the doctor directly. The physician advisor is a doctor who helps the documentation team by educating their clinical peers. 52. What is the main benefit of performing a concurrent chart review while the patient is admitted? You can ask the doctor questions immediately, while the clinical details are fresh in their mind. This prevents missing information later on, and speeds up the final medical billing process for the hospital. 53. How is a retrospective chart review different from a standard concurrent chart review in a hospital? A retrospective review happens after the patient leaves, which makes it harder to get answers quickly. Doctors often forget the old case details, so retrospective queries are usually much less successful overall. 54. Why do clinical documentation managers track the financial impact of your daily physician medical queries? They must prove to the hospital leaders that your department brings in more money than it costs. Showing a positive financial return on investment keeps your clinical documentation department fully funded and secure. 55. What happens if a government auditor finds a leading query in a patient medical hospital chart? The auditor will remove the medical diagnosis, and they will force the hospital to return the money. Leading queries are strictly against the rules, because they unfairly force a doctor to write something specific. 56. Why is a multiple-choice query considered safe and compliant under the medical coding industry guidelines? It gives the doctor several clinical options, including a clear choice to disagree with your medical findings. This allows the doctor to use their independent medical judgment without feeling pressured by your question. 57. Why must a doctor document if a severe sepsis infection was present on admission very clearly? It proves the hospital did not cause the dangerous infection, protecting them from harsh financial penalties. Medicare penalizes hospitals for acquired infections, so capturing present on admission status is incredibly critical. If you found this video helpful, please get the full course in the description below. Section 4. Welcome to Section 4 of our study journey, where we explore compliance and electronic health records. Hospitals rely on digital systems to manage patient data faster, but incorrect use can create serious billing and documentation issues. Be careful with copy and paste notes, because outdated information can create inaccurate charts, lead to medical errors, and trigger compliance audits. Always encourage fresh, accurate documentation, and remember that only providers can make changes to medical records. Professional ethics and compliance protect both patients and hospitals. Follow coding rules carefully, because laws like the False Claims Act can result in severe penalties for inaccurate billing. Discharge status codes must also be reviewed closely, since they affect reimbursement and show where the patient went after leaving the hospital. Work closely with case management and review discharge summaries to avoid costly payment delays. Another major concept is medical necessity, proving that a patient truly required hospital-level care. Clear documentation of severity, chronic conditions, and clinical complexity helps prevent insurance denials and supports accurate reimbursement. Next, we will practice exam questions and explanations to strengthen these core concepts and prepare for success. If this course is helping you, subscribe to the channel and get the complete course from the description below. 58. Why is copying and pasting notes in an electronic health record considered very dangerous for patient safety? It often brings over outdated medical data, which paints a false picture of the current patient health. Doctors must write fresh clinical updates daily to avoid making very bad medical mistakes during treatment. 59. What should you do if a hospital leader tells you to write a leading query for money? You must politely refuse that unethical order, because leading queries break the official medical coding rules completely. Protecting your professional ethics is incredibly important, and it keeps the hospital safe from legal government audits. 60. How does the False Claims Act punish healthcare facilities that cheat on their Medicare patient billing records? The government forces the cheating hospital to pay massive financial fines for submitting completely fake medical claims. Good clinical documentation stops false claims from happening by ensuring every code has solid medical chart proof. 61. What does the patient discharge status code tell the insurance company at the end of the stay? It tells the billing company exactly where the patient went after they left the main hospital building. If the patient goes to a rehab center, the hospital might get paid a different financial amount. 62. Who usually helps plan the final patient discharge location within a large modern healthcare hospital facility? Case managers and social workers usually plan the final patient discharge, ensuring a safe medical transition home. You should read the detailed notes carefully to verify the exact discharge status code for final billing. 63. What does medical necessity mean when we review a patient medical chart for an insurance company claim? It means the clinical facts prove the patient was sick enough to require an overnight hospital bed. If the chart lacks medical necessity proof, the insurance company will definitely deny the entire hospital payment. 64. Why is documenting chronic heart failure important when a patient is admitted for a simple broken bone? Chronic conditions require extra nursing care and monitoring, which increases the overall severity of illness score quickly. Showing a high severity score helps prove medical necessity, justifying the expensive hospital inpatient admission care level. 65. What is a cloned medical note in an electronic health record computer system at the local hospital? A cloned note is an exact copy of a previous daily note, without any new clinical updates. Auditors hate seeing cloned notes constantly, because they hide the true medical progress of the sick patient. 66. How can a clinical documentation specialist help reduce the number of cloned notes in the hospital system? You can educate the medical doctors daily, explaining why fresh notes are critical for proper patient care. Building good habits takes time and patience, but it greatly improves the overall medical record quality fast. 67. Why do we query a doctor when they use conflicting terms in the exact same medical note? Conflicting terms confuse the medical coding team, making it impossible to assign the single correct billing code. A clarification query politely asks the doctor to choose one specific diagnosis, clearing up the chart confusion. 68. What role does a physician advisor play when doctors refuse to answer your polite daily medical queries? The physician advisor talks to the stubborn doctors directly, explaining the importance of proper clinical documentation rules. Having doctor-to-doctor conversations works very well, building much stronger teamwork across the entire hospital facility. 69. Why must you never add a diagnosis to the medical chart without the doctor writing it first? Only a licensed medical provider can legally diagnose a patient, based on their personal clinical exam findings. You are not licensed to practice medicine, so you can only suggest options through a compliant query. 70. What is the biggest risk of using templates to document a patient physical exam in the computer? Templates might automatically say the patient is perfectly healthy, even when they are actually feeling very sick. Doctors must edit templates carefully every time, to ensure the note reflects the true clinical patient condition. 71. How does a strong documentation program protect the hospital from harsh government Medicare audits and financial penalties? It ensures the medical record is fully complete, providing strong clinical proof for every single assigned code. When the chart supports the build codes perfectly, auditors cannot easily take the earned hospital money away. 72. What should a medical coder do if the discharge summary disagrees with the final daily progress note? The coder must send a clarification query, asking the attending doctor to resolve the conflicting medical information. The discharge summary is usually the final word, but any major conflict requires official physician medical clarification. 73. Why is it important to capture every single secondary diagnosis before the hospital patient finally goes home? Capturing every diagnosis maximizes the hospital reimbursement and accurately shows how complex the patient care truly was. Once the final bill is sent off, it becomes much harder to add missing medical conditions later. 74. What is the most common reason an insurance company denies a hospital claim for lack of necessity? The clinical notes simply do not prove the patient needed intense care inside a massive hospital building. Your daily queries must capture severe clinical signs, proving the patient was too sick to go home. 75. How do you handle a situation where a doctor gives a verbal diagnosis but does not write it? You must ask them to officially write it down, because verbal answers are never accepted for coding. If a diagnosis is not written in the official chart, it officially never happened in the hospital. 76. Why must all clinical queries remain a permanent part of the patient legal health record for good? Queries prove how the medical diagnosis was reached, showing full transparency for any future legal hospital audits. Auditors check queries to make sure they were compliant and did not unfairly lead the attending physician. If you found this video helpful, please check the description below for the full course. Section 5. As we begin Section 5 of our study journey together. Today, we are learning about quality metrics, one of the most important areas in modern healthcare. Good documentation does more than support hospital reimbursement, it proves quality patient care. Programs like value-based purchasing reward hospitals for excellent outcomes, while patient safety indicators, called PSIs, track events that may affect safety scores. Sometimes documentation and physician clarification can make the difference between a true complication and an expected medical risk. Another major quality measure is hospital readmission and mortality rates. When patients return within 30 days, hospitals must show whether the second visit was related or completely separate. Accurate clinical documentation also explains how sick a patient truly was at admission. Capturing chronic conditions and comorbidities helps reflect expected outcomes fairly and protects both hospital and physician quality scores. Your role in clinical documentation improvement is incredibly valuable, because clear records support better care, stronger public reporting, and improved patient trust. Keep practicing chart reviews, communicate clearly with providers, and continue building confidence with every lesson. If this class helped you, please subscribe to the channel and get the full course through the link in the description below. 77. What is the main goal of the value-based purchasing program in a modern healthcare hospital facility? It rewards hospitals for providing high-quality care and punishes them for making bad medical clinical mistakes. The government wants hospitals to focus on patient safety, rather than just doing lots of expensive procedures. 78. What does the acronym SCI stand for when reviewing a patient chart for healthcare quality data metrics? It stands for Patient Safety Indicator, which flags potential medical errors that happen during a hospital stay. These indicators help track things like accidental surgical cuts, or dangerous infections caught inside the hospital building. 79. Why should you query a doctor if you see an accidental laceration listed in a surgical report? You must ask if the cut was an expected surgical risk, rather than a careless medical mistake. If the cut was expected due to heavy scarring, it does not hurt the hospital public quality score. 80. How does the hospital readmission rate metric measure the overall quality of recent patient medical healthcare treatments? It tracks how many patients have to return to the hospital within 30 days of going home. A high readmission rate suggests the doctors might be discharging sick patients before they are fully healed. 81. What should the medical documentation prove if a patient is readmitted for a completely new health problem? The notes must clearly prove the second hospital visit had nothing to do with the first visit. This shows the hospital did not make a mistake during the first round of clinical patient care. 82. How do accurate clinical queries help improve the expected mortality rate score for a large medical hospital? Queries capture all the severe illnesses, proving the patient had a very high natural risk of dying. This helps explain why a patient might pass away, protecting the hospital from looking careless or dangerous. 83. Why do doctors care about public quality metrics just as much as the hospital administration team does? Because physician-specific quality scores are also public, affecting their personal reputation in the local medical community. Showing doctors how proper documentation helps their own scores is a great way to get their cooperation. 84. What happens to a hospital financially if they have terrible patient safety indicator scores for the year? The government will reduce their Medicare reimbursement payments, causing the hospital to lose a lot of money. Quality and financial payments are tied directly together, so clinical documentation is extremely important for hospital survival. 85. Why is chronic heart failure a very important condition to capture for hospital quality and severity metrics? It is a severe chronic disease, which makes it much harder for a patient to heal properly. Documenting this chronic disease increases the severity of illness score, justifying the need for longer hospital stays. 86. What is the best way to explain the complex value-based purchasing rules to a busy attending doctor? You should use very simple language and show them how the rules directly impact their own patients. Keeping your explanation short and focused on clinical care respects their time and builds a strong relationship. 87. Can a medical coder remove a patient safety indicator code without asking the attending doctor first? No, the coder must always query the doctor to clarify the clinical facts before changing the code. Only the medical provider can officially state if a surgical complication was expected or an actual mistake. 88. How does catching a present on admission infection help the hospital value-based purchasing quality metric scores? It proves the patient brought the infection inside, meaning the hospital did not cause the dangerous problem. This keeps the infection off the hospital's safety record, protecting their public reputation and their financial payments. 89. Why do clinical documentation specialists need to read the patient discharge summary very carefully every single time? The summary lists all final diagnoses, ensuring no chronic conditions were missed during the long hospital stay. Catching missing diagnoses at discharge ensures the final billing code reflects the true complexity of the patient. 90. What should you do if the doctor documents a complication, but the nursing notes show nothing happened? You must send a clarification query, asking the doctor to confirm if the clinical complication really occurred. Conflicting information between doctors and nurses must be fixed before the final medical bill is sent out. 91. How does severe malnutrition affect the expected length of stay for a sick hospital patient receiving care? Malnutrition makes the body very weak, which means the patient will need extra days to recover fully. Documenting malnutrition explains why the patient stayed longer, preventing the insurance company from denying the extra days. 92. What is the main reason we track how often doctors agree with our clinical documentation chart queries? The agree rate tells us if our queries are medically accurate and helpful to the clinical care team. A high agree rate proves you are reading the charts well and providing great advice to doctors. 93. Why is it important to capture the exact type of acute respiratory failure in a patient medical record? Different types require different complex treatments, which changes the severity of illness score for the sick patient. Hypoxic and hypercapnic failures show different clinical problems, proving the patient needed very intense medical respiratory care. 94. How does poor clinical documentation lead to unfair medical malpractice lawsuits against a good healthcare hospital facility? Bad documentation makes it look like the doctors made mistakes, even when they provided perfectly good care. Accurate notes serve as legal proof of great care, keeping the hospital safe from false legal claims. 95. Why should a documentation specialist review the patient chart every single day during the long hospital stay? Daily reviews help you catch missing diagnoses quickly, before the busy doctor forgets the important clinical details. Catching errors early makes it much easier to fix them, improving the final quality of the chart. If you found this video helpful, please check the description below to get the full course. Section 6. Welcome to Section 6, the final part of our study journey together. You have learned a lot, And now we focus on one of the most important responsibilities, teaching doctors how to improve documentation. Short, practical training works best. Use real patient examples, keep sessions simple, and focus on one topic at a time. Clear documentation reduces chart errors, improves patient care, and helps the entire healthcare team work more effectively. We also need to understand clinical audits, which happen after billing is complete. Insurance auditors review charts to find documentation and billing mistakes, and unclear records can lead to financial losses. Your daily chart reviews act as protection against these audits. Track your query success rates, improve communication with doctors, ask senior specialists for feedback, and celebrate documentation successes to build stronger professional relationships. Finally, stay updated because coding and documentation guidelines change every year. Sharing new updates with medical staff makes you a valuable resource and strengthens the clinical documentation program. Now it is time to move into the final exam questions. Read every explanation carefully, trust the knowledge you have built, and give each question your full attention. If you enjoyed this course, please subscribe, and get the full course using the link in the description below. 96. What is the most effective way to teach a busy doctor about new clinical documentation rules? You should use short training sessions and show them real patient charts to explain the rules. Doctors learn best from real clinical examples, rather than reading long and boring medical coding books. 97. Why should you praise a doctor when they write a very clear and accurate medical note? Positive feedback builds a strong relationship, and it encourages the doctor to keep writing good notes. Doctors deal with high stress levels, so your kind words make them feel very appreciated daily. 98. When do the official medical coding guidelines usually receive their big updates during the calendar year? The major coding updates are typically published during the late fall season of every single year. You must read these new updates carefully, so you can share the changes with the doctors. 99. What happens if an insurance auditor finds a major billing mistake in a patient medical chart? The hospital must return the paid money, and they might face very strict legal financial penalties. Your accurate chart reviews protect the hospital by ensuring every code matches the clinical medical evidence. 100. Why do insurance company auditors specifically look for cloned notes in the electronic health record system? Cloned notes often contain old medical data, making it very easy for auditors to deny payments. Doctors must write fresh clinical updates daily to prove the patient still needs expensive hospital care. 101. What should you do if a doctor completely ignores your polite medical queries for several weeks? You should ask a senior physician advisor to speak with the busy doctor about the problem. A physician advisor can explain the rules clearly, using doctor-to-doctor communication to build teamwork. 102. How does poor clinical documentation impact the final legal defense of a sued medical hospital facility? Messy charts make the hospital look careless, which helps the lawyers win their medical malpractice lawsuits. Clear and accurate notes serve as strong proof, showing the hospital provided perfectly good patient care. 103. Why is it a bad idea to teach doctors too many coding rules at one time? Busy doctors will feel very overwhelmed quickly, and they will forget everything by the next morning. You should focus on one topic at a time, keeping your daily clinical lessons very simple. 104. What is the main purpose of reviewing your own personal query agree rate every single month? It helps you see if your queries are accurate, and if doctors respect your clinical advice. A low agree rate means you need help, so you should practice reading medical charts more. 105. Why must a clinical documentation specialist understand the basic pathophysiology of common human medical diseases clearly? Understanding diseases helps you read the chart and spot missing diagnoses in the daily nursing notes. When you know the clinical signs of sepsis, you can easily ask the doctor about it. 106. How do accurate patient medical records directly improve the daily communication between different hospital nursing units? Clear notes help the next clinical team understand exactly what happened during the previous hospital shift. This prevents dangerous medical mistakes from happening, keeping the sick patient safe during their hospital stay. 107. What should you do if the principal diagnosis does not match the actual hospital admission reason? You must send a clarification query immediately, asking the doctor to confirm the true main diagnosis. The principal diagnosis drives the final payment, so it must match the main reason for admission. If you found this video helpful, please check the description below to get the full course.